Meeting to order. First insurance meeting and possibly the only insurance committee meeting for the first referral of bills. The bill I'd like to take up first is Senate Bill 2603, salvage or abandoned vehicles, authorized to disposition by auction firms on behalf of insurers. This legislation deals with totaled vehicles and the difficulty that some of the car parts businesses or auction houses or insurance companies have in getting correct title to get rid of the vehicle. Obviously, after a person has been paid their total loss, a lot of times they lack motivation to actually get the title to the insurance company, and sometimes they don't have the title. So I'd like to recognize Mark Binder with Copart. Mark, if you'd please give a summary. Basically, this deals with a salvage title on an auction company or a car parts company being able to get clear title so that they can dispose of the vehicle after a total loss. Mark, welcome to the Senate.
Oh, I'm sorry. Sorry about that. Thank you. What it does is allows us to process the title when the customer has been paid for the claim and has not provided the title work for the vehicle. And it allows us to do it in a very efficient way compared to the current statute. And it also allows us to sell vehicles when or to get a title for a vehicle when it has been abandoned at our facility. And there's currently no process right now for us that is very efficient. And this allows us to move those vehicles with proper notice and to the customer. And if there's any questions, I'll be glad to answer them from the committee.
Okay, this will streamline the process to get a salvage title so that the insurance company can dispose of a vehicle after a total loss. Any other additional questions? Yes or no?
I have a question. I just and you also said that the insurance company has paid the claim.
Yes.
Okay.
Okay, Senator McClendon, you move title sufficient to pass? Okay, Senator Thomas.
Yeah, that's better. Need to thank Senator Horn for helping with this technology here. It's something about educational awareness and getting the information out to the regular general public. Could you elaborate on that?
Yeah, there are two communications that are required to be sent to the vehicle owner so that they are aware that we have the vehicle owner gives consent to the unit being brought to our facility. So that's the first, I guess, checkpoint. So they say you can have the car, they bring it to Copart's facility or our competitor. And then we're required to send notice in the statute to the vehicle owner, advising them to come get their vehicle, and if they don't after a certain amount of time, then we proceed with the steps.
Okay, what is the time?
It's 15 days on the first part, and there's 2 notices on that, and the second part it's 30 days. So they've been given notice and they have 30 days to come get their vehicle.
Okay. Thank you, Mr. Chairman.
Okay.
Thank you, Senator.
We have a motion title sufficient to pass. All in favor say aye.
Aye.
Any opposed? That bill will be reported. Thank you so much for being with us today. Okay, I'd like to go to Senate Bill 2332, Comprehensive Hurricane Damage Mitigation Program. All right, this was a program set up after Hurricane Katrina. There's at one time had been monies in the fund for mitigation work to be done on residences to try to improve the construction in the affected areas to keep the rates low, obviously, and to improve so that if another storm came, that the damage would not be as severe or no damage at all. This fund currently has no money in it. I've spoken with Lieutenant Governor Hostman, and we're going to have hearings again this summer. We had a great hearing last summer on the wind pool Well, the wind pool not admitted policy fee is up for repeal next summer. So we're going to look at all the ways that these different agencies are joined at the hip. The wind pool, the ratings bureau, the surplus lines association. This mitigation fund is in that mix as well. And so what we want to do is just extend the repealer where we can keep this mitigation fund open to where possibly this time next year we'll fund it or it'll be rolled into another program. Simple enough. Any questions on that? It's 4, let's see, it goes to, yes, sir, I think it's 4 years. Stands repealed on 2025, yes, sir. Senator Horn moves title sufficient to pass. All in favor say aye.
Aye.
Any opposed on that? That bill will be reported. Thank you. Okay, Senate Bill 2336, Mississippi First Responders Health and Safety Act. You're going to get to know this bill like the back of your hand by the time this is over with, because we dealt with it last year. This is the bill that Senator Carter passed a few years ago to provide cancer policies for our first responders who contract cancer in the line of duty. There was no funding mechanism in it, unfortunately. There have been several attempts to fund this, but right now it falls on an obligation of the fire districts or the municipalities or the counties. And that's something else we're going to discuss this summer in this whole discussion is how to fund this particular mandate, for lack of a better term. Your municipalities and your counties are in favor of us extending this requirement date. We're extending it 1 year further down the road so that we can have that hearing this summer and come up with a source of funding. It's a lot more cost effective for us to have one plan than for all these counties and fire departments and cities to have individual policies. As you might imagine, that's the effects of a group policy. So we're just extending that to 2024. Any additional questions? All right, Senator Younger moves title sufficient to pass. All in favor, please say aye.
Aye.
Any opposed? The bill will be reported. Thank you. All right, Senate Bill 2337 deals with the Mississippi Surplus Lines Association. This is another entity that's joined at the hip with the wind pool and the ratings bureau. And this fund raises revenue from a stamping fee on surplus lines insurance. And there's fees that are generated with this association, and this legislation would give Commissioner Cheney or the Department of Finance the opportunity to sweep those excess funds to the general fund or to any fund that our agency might come up with. This possibly could be a source of funds for the mitigation fund. So that's one example. But the Lieutenant Governor requested that we also put the Department of Finance and Administration in there in addition to just the Department of Insurance. Any questions on that? Senator Blackman moves title sufficient to pass. All in favor, please say aye. Any opposed? That bill will be reported. Okay, Senate Bill 2602, the non-admitted insurance policy fee. All right, this is what we had our hearing on this summer, and I want to compliment our committee. We had 100% attendance at our hearing this summer, which is, we don't even have that today. So I thank you for your time this summer. The governor wants us, Lieutenant Governor wants us to get together again this summer. And this non-admitted insurance policy fee, there's a 3% fee placed on non-admitted insurance policies. A non-admitted insurance carrier is someone outside the state who typically writes risks that many insurance companies don't want to take. And so there is a fee, and it, as you might recall from our testimony this summer, it amounts to $13 to $15 million a year, and that money right now is going to the wind pool. The wind pool has, Mr. Cheney, is over $300 million in assets right now. The wind pool has over $350 million in assets, and this would take $5 million to go to our rural fire truck program and $1 million to go to the fire academy for fire apparatus and equipment grants before the money's diverted to the wind pool. Once this money goes to the wind pool, it's forever lost. We can never get it. So this is a great source of funds for us to help our rural fire truck program. And Commissioner Cheney has a match program to where the counties can put up some money so the $5 million can go a long ways. Any questions on this? Okay, there's a motion, and there's also a question. Senator Hill?
What are the bulk of those fees used for now?
The fees are going straight to the wind pool, and it's just doing nothing but
This is just-
accumulating cash.
So this is
available.
moving money, money from the wind pool to fund possibly fund fire trucks and fire apparatus.
Statewide fire trucks, instead of the money going directly to the wind pool.
Okay, is there a line in there that tells you how much, a certain amount, or like,
Yes.
what portion?
Okay. On line 72, excuse me, it shows 5 million will go diverted and deposited in the rural fire truck fund. And then on line 76, it says 1 million will be diverted to the fire marshal's office for fire apparatus and fire protection grants. And in some of our rural areas, this can improve the fire rating and obviously reduce insurance premiums.
It certainly can, and I've been a part of working with some of the rural fire departments. Do you know what the total amount in the fund is now?
Commissioner, it's over 300 million. What's the amount in the wind pool fund right now?
300 million, they were going to get about 17 million this year and 90 million surplus fees over and above what they paid out. And they paid out about $14 million for urbanization side.
So y'all feel like the fund is healthy enough to do this?
Well, the wind pool that needs fund, originally decided that the wind pool, that fee would only last 3 years, but it's been going on for 13.
Thank you, Commissioner.
Thomas, did you have a question? Okay. Senator Blackman had the motion, title sufficient, do pass. All in favor, say aye.
Aye.
Any opposed? That bill will be reported. Thank you. Okay, Senator McClendon, Senate Bill 2623, please.
Thank you, Mr. Chairman. If I could, let me ask council one thing right quick.
Sir.
Thank you, Mr. Chairman. At this time, I'd like to offer a committee substitute for a strike-all for language that was in there by mistake.
You have a copy of the proposed committee substitute. That's what's in your file.
That's what's in the file. And also extend the repealer on this to 2025. Basically, what this bill does, it's a public safety verification program, which was established several years ago by the legislature, and gives the Department of Public Safety a tool to use, whether it's Mississippi drivers when they're stopped on a traffic stop or accident, mandated vehicle liability insurance. It's a revenue for Department of Public Safety, and it's a way for them to fund the training academy as well as another fund. Are there any questions?
Okay, the fees that are derived from this, 50% go to a trooper school and 50% go to our trauma fund. Questions, Senator Blackman?
Okay, now,
Just extending the repealer on.
that's
the
what I was,
2025.
that's all we're doing. Everything else is already in place.
Yeah.
That's
Absolutely.
what I was trying to understand.
Absolutely.
Thank you.
Okay. Senator, yep. All right, title sufficient, do pass, a committee sub, 2623. All in favor, say aye.
Aye.
Opposed? Bill will be reported. Okay, Senator Boyd's been given the envious task of working on Senate Bill 2631. It's our telemedicine bill. The best news is that we've got a reverse repealer in this, because this is still a moving project, and the great thing that Senator Boyd has done is brought all interested parties to the table. I mean, the moment we got the legislation, we contacted anybody we thought that might have an interest in this. So Senator Boyd's going to give you an update on where we stand and what she plans to do before bringing it up on the floor of the Senate. Okay, all right. 631, missing a page. Here you go.
I think we're all missing a page. Just to kind of update briefly, Senator Michelle and I were both approached by different entities. We've met with insurance providers, with the Medical Association, with the Department of Insurance. One of the good things that I believe came about is during this pandemic is we had an expansion of telemedicine, and it has become an effective tool for both providers and patients. And so Commissioner Cheney office issued a bulletin as to, during the pandemic with the order as to, what would be covered for telemedicine at that point. What this bill does is we're going to go ahead and codify some of that into law. There's been some problems with some providers actually wanting to continue telemedicine services. We know this has been effective throughout the state, and so this is what, and then we also come to a definite, conclusive definition as to what telemedicine actually is. You cannot imagine how many variations that we've had in that process of trying to determine exactly what telemedicine is. This bill is a work in progress. You can kind of look through there and see what's been kind of agreed to as to what telemedicine is at this point. And we're going to continue to work with all sides to get a good bill that we feel like will be good for the patients and consumers of the state.
Dr. Horn?
Thank you, Mr. Chairman. I think this bill is a work in progress because it seems to have pages missing. I don't have the whole bill.
It's a work in progress, in that we don't have all the pages either. Okay, Janet's going to get that. The gist of the most important thing is on the last page is the reverse repealer.
Right.
Yes.
What line is that on?
I don't have it either, so Senator, what line is the reverse repealer? 83. Line 83.
Great. Just to give you, while Janet's getting some copies, I'll tell you who's been involved in the process. We started off, we thought, okay, maybe University Medical Center would have an interest in this. You change the definition of something and it can have far-reaching implications. So we've consulted legal counsel for University Medical Center. The State Medical Association's been involved. There have been a couple of private telemedicine vendors that have been involved. Health insurance companies have been involved. I fielded a call this morning at 8:30 on the way to the Capitol from somebody else who just saw the bill, who wants to give some input. And we've assured everyone that we've got the reverse repealer in it, and thank you. And that
Thank you.
all the people interested in it would be given input.
Further question, Mr. Chairman. So, right now, are mental health services able to be provided through telemedicine? And further, if so, are clinical psychologists versus psychiatrists able to offer services via telemedicine?
Dr. Boyd, you've heard from some of them, haven't you?
Yes, sir. Right now, well, that's what we want to make sure of, and that's the whole purpose for this bill, is to make sure, Senator Horn, that those services can continue to be offered through telemedicine. That's the whole purpose of this. So, is to make sure that those services can still be provided and and that's covered by all of our providers in the state.
Because I was just reading the $1 billion that we're supposed to get from the December CARES Act, and in a portion of it, it allows for telemedicine services and for mental health services. And I just want to make sure that those professionals will be able to operate through telemedicine.
Yes, sir, and that was one of the, as we've gone through this pandemic, we've had a number of individuals in the state who've been able to take advantage of services through psychiatry, psychology, through telemedicine, and I think it's proven to be, from all of them that I have heard, it has proven to be effective for both the patient and the provider as a way of a service delivery and that. So this whole bill is intended to make sure that those services are still being allowed to continue as we progress through this pandemic.
And it also provides for audio-only services.
Senator, just to be candid on that, that is one of the definitions, and that's one of the things that we are working with in getting everybody to kind of agree to the definitions right now. So right now, there's some audio interactions that are covered, and we are continuing to work through that definition process with everyone on that.
Thank you, Mr. Chairman.
Dr. Hill?
I have two questions. The first one is on line 38, where it's adding the words HIPAA-compliant telecommunications system. Would this exclude someone from being able to use FaceTime, Zoom, or Skype as a mode of communication with their patient?
My, I would like to ask the insurance commissioner to address that, so.
You can use whatever means you want to, you cannot use text, so that's
Well, my concern was that HIPAA-compliant telecommunications system may be something that is separate from just using your own computer with Skype, Zoom, or using your phone with FaceTime, that it would be something that the provider would have to buy, some kind of new technology. That is my concern, that if we already have technology, would this be some kind of built-in vendor system that the physicians or nurse practitioners would have to purchase? That would be my concern.
Your real question is the platform is being used secure and compliant with federal law? As long as they use an iPhone and they don't do some awful law platform, it's okay. And we may have to write regulations for this bill passed like it is. Presently, we operate under a bulletin issued by the department pursuant to the executive order of Governor Reeves under the COVID-19 pandemic that we're going through. So we're using what we would call a secure platform. That's basically an iPhone or a phone that is secure for the primary care doctor.
So what I'm hearing is that you still would be able to use these types of technology, iPhone, Skype, or Zoom. And the other question would be, on line 80 and 81, patients in a patient-to-provider consultation shall not be entitled to receive a facility fee. My question would be, if they have an in-person visit, would they be able to receive a facility fee versus what's provided in this bill, that if you have a telemedicine service, you would not be able to receive a facility fee?
So this is one of the provisions that you've asked a question about that is still a work in progress on this. So here's, just to kind of explain it for the full committee, where this comes into play is you have a provider that wants to make a consultation with another provider. And so the patient comes into that provider's office. So let's say they come into the nurse practitioner's office. They live in a community with the state, and they want to consult a doctor, let's say at UMC in Jackson. One of the things that is being debated right now with this language, just to be very candid, is that nurse practitioner entitled to a facility fee of some type because she's facilitating that conversation for that patient who may not be technology savvy? And are they entitled to a facility fee or not? And this is one of the provisions right now, quite frankly, that is being, that we've got a little bit of work to do on. So some of the companies don't feel that they are. Obviously, the providers feel that they should be entitled because it's taking their time and their expertise to kind of facilitate that communication. So that is one of the things we will be working on. There has not been consensus reached on that.
Just to follow up on that, I can see many instances where a provider would not have to use a, quote, telemedicine company to facilitate some kind of technological visit with another doctor in another place. So I don't even really see why this is valid, because every provider is not necessarily going to use some type of telemedicine company to facilitate some kind of interaction with another doctor when we already have ways to communicate without involving a third party.
This is not for the third party. This, what is being debated right now, this is not the third party. This is, even if they use a standard Zoom or whatever, it is whether or not the provider who is facilitating the conversation between the expert that they've consulted, whether or not they are entitled to any type of compensation for their time in facilitating that and their expertise, and maybe probably helping interpret, what is being said and making sure the patient has that care. So that's where it's not the third party telemedicine company that they're talking about. It's just it's the actually healthcare provider in their facilitation.
So this would be a fee in addition to their regular visit charge?
Yes.
So some type of fee for their technological service?
Not just technological, but medical as well, as they're helping facilitate that with the patient.
Thank you.
Yeah.
Thank you, Mr. Chairman. On line 79 to 81, which you all just been discussing, it says the patient shall not be entitled to receive a facility fee. Are you talking about the provider?
No, they're actually talking about the patient in this instance. This was suggested language. This is where we're still, again, we're telling you this is a work in progress on this. That this patient would not be entitled to reimbursement or anything like that on this. And there was a reason that they put this in here, and so just to make sure that it was clarified that this had to do with the provider only. It was a clarity statement that they did. Again, Senator Blackman, why this is
Okay.
definitely a work in progress on
Okay,
this.
so it's the provider that's not supposed to be receiving the facility fee?
No, it
Is
is
that
the
reimbursed?
patient.
Okay, you said it's the patient.
It is the patient.
Okay,
So-
my other question is, well, I got two. If the provider utilizes telemedicine for a consultation with a patient, is that provider receiving the same amount of money that they would receive as in person?
Is that provider, I'm sorry.
The provider, the doctor that you're seeing via?
Via telemedicine?
Yes, ma'am.
That is what is one of the provisions that is in contention on Section 5 over here, 68 through 72, is, that is one of the pieces of language that we are working on, is it the same, are they being compensated the same for their time or not? And candidly, that is one of the provisions that is being very much contested and that we're trying to work through right now.
Okay, because when you go to in-person, the first thing that the nurse does, they'll take your vitals, your blood pressure, your weight, your temperature. And if you're doing it via telemedicine, they're basically asking you to do it.
And I think that's the case, and from the other side, and they are expending the same time, if not more, oftentimes when they're doing these telemedicine appointments. This is what I've been told, is that, so for instance, like you bring let's say they're doing a check and looking at all your medications. That's something that's frequently done in general practitioner terms, and they're looking at all of that. It's very quick when you bring those bottles in, and they're quickly checking. It is taking sometimes significant more amounts of time to do those checks because, you know, there's a process and easier to do it. If they're really trying to get the patient to do something, it takes a little bit more time for them to get the same information that it typically does with being in person. Also, too, the technology challenges of some of the patients also has been equated to taking a good bit more time for them as well. So these are kind of all the things that kind of we are being challenged with trying to adhere and kind of listen to all those sides with that. So that's kind of the information we've been presented. So, you know, some of the providers say that it's actually taking them a good bit more time to facilitate these, but believe it's worth it because of the pandemic.
But
So-
would not the provider, the doctor, the primary care person already have in their records what medications their patient is on, and they just be doing a checklist as to?
Those, oftentimes patients go and they see specialists and they add to them. And so they've got to update those constantly, you know, and checking on that because, you know, many patients are, you know, they're doing those maybe yearly visits. And so it is, it is just taking a little bit longer in that process. But, so that's really what, again, no hard answers are we giving you exactly on all that today, but this is kind of all the information we're being presented on this.
But when you go to a specialist, usually your primary physician is the one who refers you. And also, when you go to that specialist, they have a checkoff, they have something who referred you, who is your primary physician, and then they send the reports to your primary physician, because I've tried to get around it.
And sometimes sometimes that paperwork is not filled out oftentimes, so that's why you gotta do that double check with the patient, is what, because it's interesting you're asking this, because those are the same questions I've hit back with, and that is not a smooth system sometimes, because sometimes patients don't put their primary care, sometimes that information is not pulled back to them, and so they are constantly having to reassess and relook at that same information.
Thank you, Mr. Chairman.
To follow up on the question I asked about HIPAA compliance, I was searching on my phone and I see where that HHS has waived HIPAA compliance during the pandemic. So my next question would be, while we're still in the middle of the pandemic, why would we want to do something contrary to what HHS has given for flexibility for telemedicine visits? And also, I would also agree with you that I've had to do technological visits with my mother and set them up for her because she was not technology savvy enough. And I agree with you that her doctor spent more time with her on the telemedicine visit than if she would have walked in that door. But my main question is about the HHS having this HIPAA compliance waived during the pandemic, and why would we now be doing something that's contrary to the flexibility that HIPAA has given?
Well, I think that's where Commissioner Cheney comes into play in making sure they will probably have to promulgate regulations as to what is true HIPAA compliance and not. So I don't think anybody is trying to make it, and that's why, again, I stress again, this is a work in progress. This is why we're trying to make it as flexible as need to be, because we know that this has worked during the pandemic, and we want to make sure that we take the practical things that have worked and make sure that we do have providers that will reimburse in this way as we continue through this pandemic.
All right, do you have a motion, Senator Boyd?
Yeah, Title Fish, okay.
Okay, we have requested amendments, Senator Hill.
My amendment would be to strike the words on line 38, HIPAA compliant. And we can put some time frame in there until HHS waives or ends their waive on the regulations.
All right,
Because
Senator Boyd.
Okay, just letting you know, I've received confirmation, FaceTime is not HIPAA compliant. And we're going to need to let the Department of Insurance really do some regulations on this, because I do think, in fairness to the insurance companies as well, if they're going to reimburse for services, there needs to be some HIPAA compliance with that as well. That's a standard with that. So again, y'all, we're going to look at this completely. Again, we're going to be working with the Department of Insurance on this. And so I would urge that you give us the flexibility to do this and trust that, and we can meet with everyone individually before this goes to the floor and go through the components of this bill again.
Yes, Senator Hill.
I would just urge you to support my amendment, since HHS has this technology, HIPAA compliant technology portion waived during the pandemic.
Mr. Hill, I understand. What did you say about your amendment? Did you,
I
Withdraw
think
your-
Senator Cheney wants to say something.
Senator Cheney,
I
would
mean,
this help or
Commissioner Cheney.
hurt our bill to remove
Point of order.
HIPAA compliant?
I'll talk real loud so you can hear me. FaceTime is allowed in an emergency and it's compliant with HIPAA in an emergency situation. It may not be compliant if it's not an emergency situation. So what the bill
So what I understand from Commissioner Cheney is, rather than putting this in statute, they need the regulatory authority to follow HHS's changes. Is that correct, Commissioner? I said, so what you're saying is you need the flexibility and regulatory authority to follow HHS's, their moves rather than putting this permanently in statute. So you would support my amendment?
Okay. Do you withdraw your amendment, or is it still before
No,
us?
I want my amendment.
Okay, so-
I have the support of the commissioner.
All right, the question's before us on line 38 to remove HIPAA compliant. Any additional questions on that?
My amendment would be to remove the words HIPAA compliant in lines 38. That way the commissioner could do it by regulation.
Okay, question from Senator Blackman?
Thank you, Mr. Chairman. Okay, so if we remove HIPAA compliant, then would the individuals be able to get reimbursement for their Medicaid, Medicare? Based on what?
Based on HHS's waiver, I believe I'm correct, right, Senator Cheney?
That's correct. In some cases, Medicare and Medicaid allow the use of face time, in some cases they don't. So if you remove it, it would allow the Medicaid and Medicare people to be reimbursed.
Okay.
Okay, the vote before you. If you favor the amendment, please vote aye. Aye. Any opposed?
No.
The noes have it. The bill will not be amended. Senator Boyd?
Title sufficient D-Pass committee sub.
Okay, all in favor, say aye. Aye. Any opposed? That bill will be reported. Okay, our last item of business today is a governor appointment to the Workers' Comp Commission, Elizabeth Beth Harkins. This is a reappointment. Ms. Harkins, you've got your information in your file, has served on this commission a prior term from 2015 to 2020. There's no adverse findings in the report. And I see that we have on our Zoom call today Senator Josh Harkins, who happens to know Ms. Harkins very well. And it might be an opportunity if you want to get back at her, Josh. Would you have anything you'd like to say?
No, I'm planning on spending Thanksgiving and Christmas with her, so I'll just,
Okay. All right, thank you. Senator Horn.
Thank you, Mr. Chairman. Thank you. I've had the pleasure of knowing Ms. Harkins ever since she was first appointed. She's appointed as the employee representative on the commission. I have been truly impressed with the work that she's done in that capacity, and would like to have make a motion at the proper time.
Okay, you're recognized.
My motion is do advise and consent.
Motion is we do advise on the appointment of Ms. Elizabeth Beth Harkins to the Workers' Comp Commission. All in favor, say aye.
Aye.
Any opposed? Senator Glendon moves we rise and report. All in favor, say aye.
Aye.